It's my pleasure this morning to introduce to you not one, but two speakers this morning. Lori Serafino-Harper and Terri Dean. Lori Serafino-Harper was born and raised in Niagara Falls, Ontario. Lori was educated at McMaster University in Hamilton, Ontario, where she received her Bachelor of Commerce. After working in Toronto for 5 years, she returned to this area to further her education, completing her Master of Arts in Audiology at the State University of New York at Buffalo. Lori has been employed at Hotel Dieu Shaver Health and Rehabilitation Center since 1991 as an audiologist, senior audiologist, and since 2018 has been the manager of Audiology, Speech, and AAC. She resides with her family in Niagara Falls. Terri Dean was born and raised in the Niagara region. Terri now resides in Grimsby. Terri attended the University of Western Ontario, now Western University, where she completed her Bachelor of Arts in Psychology with a minor in linguistics, as well as her Master of Clinical Science in Audiology. Terri has been employed at Hotel Dieu Shaver Health and Rehabilitation Center since September of 2010. In her spare time, Terri loves to cook and spend time exploring Grimsby's many parks with her husband Matthew and 2 young boys. We look forward to hearing your presentation this morning. So please welcome Terri and Lynn. Laura, thank you.
Yeah, okay, come on. Click that. All right. And I can see it over there. See it up here, and I should be good to go. Okay. And then, oh, just a minute. Yeah, by all means. So, okay.
Good morning. Can everyone hear me?
Yes.
Okay, great. I'm Lori, as you mentioned, and this is Terri. And we are going to be speaking today about hearing and what is new in this important health area. I want to congratulate the new inductees, Martin. I agree with you about the beer. And Dan, lovely. Where is he? There he is. With the exercise, that's so important at this stage of our lives, right? And to keep so active. Another important thing at this stage in our lives is our hearing. So we're going to talk a little bit about that. I want to thank you all for the opportunity to speak today. Shout out to Duncan McLaren, Bill Smith, who got me started here and helped organize today. John Sen for the technical support. John, I know from Niagara Men's Choir as well. Aha. You didn't put that connection together, did you? Yep, Steve's my husband. Yeah. And Hugh Lerma for the nice introduction. Thank you so much. So today's agenda, I'll just show you the agenda here. We're going to talk a little bit about Hotel Dieu Shaver in general. I'll give you a little bit of a historical background on that. Then Terry's going to take it over and he's going to talk about the real meat of today's talk, the ear and how we hear, hearing loss and signs of hearing loss, assessment and intervention for hearing loss. She's going to talk about hearing aids. I see that some of you are wearing them. I see some familiar faces out there, so I know that some of you are our patients as well. She's also going to talk about assistive listening devices. And she's also going to talk about FM systems. Sometimes in situations like this, it's a little more hard to hear, a little more difficult. So some of these assistive listening devices can help both in the home and FM systems in in situations like this, and she'll tell you more about that. We're also going to learn about hearing loss and cognitive health and falls prevention. And then we have time, I believe, at the end for questions or any comments you may have. However, if you do have questions during my talk, Terry's talk, just stop us, put your hand up and ask a question if something's not clear or if you're not hearing us properly. Hotel du Shaver Health and Rehabilitation Center. Let's give you some history on this. So the building is right across from Brock University. It's the former SAN. Some of you might remember it as the Sanatorium for Tuberculosis. It was built in 1930. It's a very old building now. However, every 4 years, this building goes through accreditation, and we always marvel. The accreditors come and they do an intensive look at everything in the building, and they're always impressed with this building because of its age and how it's maintained by our wonderful maintenance department and how our patients are treated by our frontline staff. This building is going to be replaced very soon. You're going to hear more about it. There was a press release about it in May. You may have heard. We are in the build phase, or the actively, or sorry, tripping over my words now. We are in the planning phase with HDR Architecture Associates, Inc. for a new building, a new inpatient building that's going to go behind this one, overlooking the escarpment and the beautiful greenery that's back there. The targeted completion date is sometime in 2033. Yeah, I'll be retired by then, believe me. Okay, so Hotel du Shaver is Niagara's only specialty rehabilitation and complex care hospital. We annually have 1,200 inpatient admissions, 25,500 total outpatient visits. So after people are rehabbed on the inpatient side, they come back for outpatient therapy, as well as coming to us from the community. The inpatient hospital has 134 beds currently. That's going to increase with our new build. Patient satisfaction rate is 99.6%, and we're always very consistent with that. So if you ever are at Hotel du Shaver for audiology or anything else, and you're given a questionnaire form, please fill it out because we take them very seriously. We send all the information up to the Ministry of Health, and gives us great feedback on what we can do to improve our services and keep them top notch. We have 520 employees.
I can't remember if we have now the Zoom people won't see this, but
okay.
you may certainly use the red button there.
Okay, thank you, John.
Thank you, Ann.
Thanks, Andy. We have 520 employees, 33 medical staff, so 33 physicians and nurse practitioners, 70 volunteers, and at least 20 students come through our doors every year, if not more. I think that's an understatement. Our catchment area for rehab is from Fort Erie up to Grimsby. So I mentioned before that we are Niagara's only specialty rehabilitation and complex care hospital. The programs that we have are high-intensity rehab, low-intensity rehab, short-term medically complex, and end-of-life programs. On the outpatient side, I'm going to show you this building. I'm going to show you a picture of that building where we're located in the outpatient building. We have the Augmentative and Alternative Communication, or AAC clinic. Anyway, we won't talk more about that one. That's another talk. Audiology and hearing aid clinic, the cancer rehab, neurology, orthopedic clinics, Parkinson's Center for Rehab, speech and language pathology, one-to-one services, and South Niagara Health and Wellness Center, which is actually an offshoot of Hotel du Shaver and is currently located in Fort Erie. And here is that outpatient building. So this outpatient building is located to the right of the Shaver, the old SAN, and it's connected by an above-ground glass tunnel. So we are the building that's a little bit recessed back, and it was formerly called Niagara Rehab. When I started there way back when, it was Niagara Rehab. Now we are Hotel du Shaver. We're located right across from Brock University, and we are through those front doors that you see. Where's my little pointer here, John? Oh, there we go. Right through these front doors here, and to the right is where the audiology clinic is located. It's very easy to get to. A little bit of a history lesson here about just the audiology program. The audiology program started in 1972, shortly after the building was built. I think it was built in 1970 or so. In 1974, we began testing pediatrics, and we still test pediatrics. In 1990, just before I started there was a big building expansion. So we pretty much, it seems like we doubled in size, I believe. And we added a second sound booth. So the audiology department was growing. The hearing aid clinic was established in 1998 in this building when the government said, oh, gee, audiologists know a little bit about hearing. Yeah, let's let them sell hearing aids. And that's why we only opened and started selling hearing aids in 1998. In 2002, the Ontario Infant Hearing Program was established, and we became a follow-up test center for pediatrics and an amplification site for the IHP program. In 2005, the governance and management of the two sites was assumed by Hotel du Hospital. Hotel du Hospital from Ontario Street from 1953 yet. And they came in, the governance came in and formed Hotel du Shaver Health and Rehabilitation Center. In 2023, we added our third large sound booth. So now that makes all three of our booths fully accessible to the public, and it just makes for easier testing for everyone. It's much more comfortable. Oops, back up. Here is our staff, recent picture just taken. So we have 3 full-time audiologists. We have, let's point it out here, Ashley, there's Terry, and there's Tom. And we have one communication disorders assistant, Shin, and then me on the end there. Our resources in the department, I mentioned we have 3 large sound booths, 3 hearing aid dispensary offices for fitting and adjusting hearing aids. So that's where the actual work with hearing aids happens. So whenever we do these talks, we always find out that in the crowd, people go, wow, I knew you tested hearing. I didn't know you sold hearing aids. But yes, we do sell hearing aids, and we've been doing it for a while. We're pretty good at it. We also have DPOAE equipment for objective test measures, mostly for infants, but sometimes for more of the difficult to test adult population, we use that for. It's an objective measure of hearing. We also do cerumen management, or that's a fancy word for wax removal for existing patients. The Audiology and Hearing Aid Clinic. Oh, and I should do a shout out too to all the international people attending this meeting today. Amazing. But one of our patients basically read this slide, it seems, because he's mentioned this when he's talking about our services. The Audiology and Hearing Aid Clinic is a fee-for-service program within the hospital. All of our proceeds are reinvested back into the hospital to allow for continual organizational improvements to benefit our patients, programs, and the Niagara community. I thought I was being told I had to stop talking. Okay, audiologists. So audiologists in general, what are audiologists? There's a lot of people out there that do hearing aids and things like that, but audiologists specifically, and the practice of audiology is the assessment of auditory function and the treatment and prevention of auditory dysfunction to develop, maintain, rehabilitate, or augment auditory and communicative functions. All of our audiologists, including myself, are registered and in good standing with the College of Audiologists and Speech Language Pathologists of Ontario, or CASLPO. And in order to work and practice in Ontario, you have to be a member of CASLPO. We all have a minimum educational requirement of a master's level postgraduate degree. The audiologist specifically at Hotel du Shaver, audiology is a big field. We specifically do the following things. We assess hearing and identify hearing loss. We prescribe hearing aids. We sell hearing aids. We prescribe assistive listening devices such as FM systems, TV boxes, things like that when we feel they are needed. We provide ongoing care to help you better understand your hearing loss and support your hearing aid use. Very important thing, that ongoing care with your hearing aid, just to make sure it's always functioning properly and that it's not sitting in a drawer at home. They're far too expensive to sit in a drawer. We also assess for auditory processing disorders, or APD. That's a test that we do mostly for school-age children. We assess tinnitus or ringing in your ears, and we provide tinnitus management options for you. As I mentioned, we provide cerumen or earwax removal for our existing patients, and we also provide custom fit ear molds for swimming, sleeping, and noise protection when you're mowing the lawn and things like that. And I am now finished, and I'm going to turn it over to Terri. Any questions so far? Okay, great. Do you want to hold? Okay. I'm just going to put my water over.
All right, so can everyone hear me okay? No, okay. A little bit higher. How's that? Is that better? Perfect. So my name is Terri, and I'm going to be talking to you today about specifically the auditory system and how we hear. A little bit about hearing aids, and then some cognitive health as well. So this is just a diagram of the ear. There's various parts to it. You've got your outer ear portion, which is this right here, and then your middle ear, which is the ear canal. And then you have some internal components, the sensory organ of hearing called the cochlea. And there is a video on the next slide that I'm going to try and play. If it works, fantastic. If it doesn't, then I'll come back and walk you through it. Sorry, the slide after. So these are just some diagrams on how you hear. So I'll just go through this actually. So again, we have our outer ear here, our middle ear, and our cochlea. When we hear, sound comes through the pinna portion here, bounces off the eardrum. This is in the middle of the cochlear portion, changes to an electrical impulse, and gets sent up to the auditory cortex in the brain. So that's just a quick diagram of the pathway of hearing, and then the video is actually on the next slide. Let's do that.
Technology.
Let's see if I can get it to work.
Have you ever wondered how sounds make their way from the source all the way to your brain? Take a trumpet, for instance. When it's played, it makes sound waves in the air. The outer ear catches the waves, which then travel through a narrow passageway called the ear canal. The sound waves reach the eardrum, which is a membrane roughly half the size of a dime. They make the eardrum vibrate, which in turn vibrates 3 tiny bones called the malleus, incus, and stapes. These bones amplify or increase the sound vibrations and send them to the cochlea. The cochlea is shaped like a snail and is the size of a garden pea. It is filled with fluid, and the sound vibrations make this fluid ripple, which creates waves. Hair-like structures called stereocilia sit on top of hair cells and are grouped together as hair cell bundles inside the cochlea. The hair cells inside the cochlea ride these waves, and the hair bundles are moved. The hair bundle on top of the hair cell turns these movements into electrical signals. As the hair bundles are moved, ions rush into the top of the hair cells, causing the release of chemicals at the bottom of the hair cells. The chemicals bind to the auditory nerve cells and create an electrical signal, which travels along the auditory nerve to the brain. Different hair cells respond to different frequencies of sound. The hair cells at the base of the cochlea detect higher-pitched sounds, such as a piccolo or flute. The hair cells toward the top of the spiral detect progressively lower pitched sounds, such as a trumpet or trombone. At the very top or apex of the spiral, the hair cells detect the lowest pitched sounds, such as a tuba. The auditory nerve carries the electrical signal to the brain, which interprets the messages as sounds that we recognize and understand.
Any questions about that? Pretty,
Terry,
yes.
is it progressive damage or loss in those cells that cause the sort of frequency-based loss in hearing?
Yes.
Okay.
So where the damage is where the pitch of hearing loss will occur. And I'll go through that as well with the audiogram. All right, now how do I get out of here?
Just to the next slide.
There we go. Okay, so I'll just talk now about what hearing loss and different signs of hearing loss. So hearing loss can be congenital or present at birth, which is why as part of the Ontario Infant Hearing Program, we do see babies. Hearing loss can be gradual or sudden. It is often a natural part of the aging process, or it can also be acquired from certain life events, such as noise exposure over time, particular medications, illness, head injury, stroke, any acquired hearing loss. You can have natural hearing loss from aging, and then you can have acquired hearing loss on top of that too. So it doesn't have to be just one specific thing. The hearing loss can also be conductive, sensory neural, or mixed. And those are the three different types of hearing loss. And I'll go through those when we look at a little bit more in depth, the audiogram. Hearing loss can also be related to what's called auditory processing. So not just the detection of sound, but actually what the brain does with the sound that it hears and the information that's coming to it. So I'll just go through some signs of hearing loss. Some of these you may recognize in family members, some you may recognize in yourself. Often we hear that people mention others seem to be mumbling, or they're not speaking clearly, they're not speaking loud enough. People often mention that they're hearing conversations, but they're not always understanding exactly what is said. So there's some misinterpretation of certain words, not necessarily the whole conversation, but particular words. Some difficulty following conversation in groups, and particularly difficulty following conversation in noisy places, such as a restaurant or a coffee shop. Also turning up the volume on your television, not necessarily for volume, but for clarity. So knowing that what someone's saying, but not actually picking out exactly what the word is. So you turn the volume up on your TV, it gets louder, but not necessarily clearer. Some things like a microphone or a microwave beep, coffee maker, sometimes even a telephone ringing if you're not able to hear those particular household sounds. Also localization, so being able to determine where a sound is coming from. If it's above you, below you, left or right, in front or behind. With hearing loss, you often lose that ability to locate sounds and detect where they are around you, which can actually become a safety issue. So we'll talk about that a little bit longer or later on too with some fall risk. Oftentimes we find people will withdraw from conversations. They'll stop going to social engagements because it is too difficult to hear. And then also hearing feels like work. It's effortful. You're tired at the end of the day. You're fatigued from working to listen in those noisy places, or when there's a family gathering with multiple people talking at once. Tinnitus often goes hand in hand with hearing loss as well, which is a ringing, buzzing sound in your head or in your ears. So I will just talk a moment about tinnitus. Tinnitus is something that a lot of people do experience. but it is an internal sound that you hear in your own ears or your own head. There's no actual external sound source, and it's only audible to you, which makes it really tricky, super subjective, and really difficult to study. It can be variable, so it can be ringing, buzzing, chirping. Some people describe it as ocean waves or a whooshing sound, pulse. Sometimes it's constant, sometimes it's intermittent. It will be there all the time or it will come and go. It will often change in pitch and or frequency. For some people, it can be loud. Sometimes it's softer. It is much more noticeable in quiet. And then right now, there's actually no known cure for tinnitus. Because it's so difficult to study and it's so subjective, different for every person, there's no actual cure for it. But there are some assistive devices and some tools that you can use to help it reduce the impact of it in your daily life. Just some contributing factors to tinnitus. So hearing loss, obviously one of the contributing factors, noise exposure. So noise exposure either over time, like a chronic steady state noise through a factory or something like that, or impulse noise. Earwax can make tinnitus worse. Head or neck injury, stress, diet, particular medications. Right. So now I'll get into the hearing test part. So we'll just talk a little bit about the assessment intervention. So the hearing test. So most likely if you've had a hearing test, you've heard the phrase, when you hear a beep, press the button. So when you come into our clinic for a hearing test, we're going to start with looking in your ears. Well, first we'll do a case history to get to know you a little bit and your main concerns with hearing. Then we'll take a look in your ears. We'll check your eardrums, check that whole emittance testing, making sure that's moving well. Then we'll have you press the button when you hear the beeps. We'll do some speech testing as well, including what's called word recognition or word discrimination, which is a particularly important score I'll mention later. We'll do bone conduction audiometry, which tests that organ of hearing directly, match the tinnitus if we're able to, or if you have tinnitus, and then some advanced testing as required. Okay, so this is an audiogram, and this is how a hearing test is plotted. So you have your frequencies or your pitches across the top, and you have your volume here on the side. Louder at the bottom, softer at the top. And the X's and O's mark the threshold for where your hearing is at the different pitches of sound. So your X is the left ear, and the circle is the right ear. So based on the hearing test, we'll look at the degree and type of hearing loss, the configuration or shape of the hearing loss profile, your word recognition score, which gives us an idea of clarity and the discrimination ability in your auditory system to make sense of similar sounding words. We'll talk about the implications of hearing loss on communication and some social interactions. And then we'll do a listening needs assessment and prescribe hearing aids based on the degree, configuration, and your individual listening needs. And then as Lori mentioned, we also do dispense and sell those particular hearing aids at our clinic as well. So there's just 3 different types of hearing loss, and I'll go through them all quickly. So a conductive hearing loss is usually in the mechanical pathway of the sound transmission. So it's when the sound is coming in through the ear, along the ear canal, or within this middle ear portion here. So an example of a conductive loss would be wax. So a wax impaction affecting the sound transmission, or an ear infection that's preventing the eardrum from moving, or a perforation or a hole in the eardrum as well. Sensory neural hearing loss is hearing loss in the actual organ of hearing here. Okay. And that is where the hair cells themselves are missing. And then where the hair cells themselves are missing or no longer functioning appropriately is where the hearing loss occurs in those particular frequency bands. That's the most common type of hearing loss that we see due to general aging, and it's usually in the higher pitch region of the cochlea, which is often why things are loud but not clear. And then you can have a mixed hearing loss, which is a combination of the two. So if you have an underlying hearing loss in the high pitches, then you have either an ear infection on top of it, that would be called a mixed hearing loss. Okay. All right, so just some hearing devices. So when we're looking at hearing devices, there's a whole variety of different kinds here. This first section here, those are called the in-the-ear hearing aids. So we take a casting or a molding of your ear, and then the hearing aid sits directly in the ear canal. These three over here, they're more of a behind the ear style hearing aid. So you have a piece that goes behind the ear and a thin wire with either a little silicone tip or a mold that goes down in the ear canal. The back portion picks up the sound, amplifies it, and sends it through the wire or the tubing to the portion that's in the ear canal. And I'll talk about the things on the bottom in just a moment. So again, just another graphic of the different types of hearing aids. You can see the way that they actually look in the ears. One of the misconceptions that I find about hearing aids is people often find they come in and they'll say they're really big, they're bulky, I see them all the time. They've substantially shrunk in size, both the in the ear, and to be honest, I find the behind the ear ones actually more discreet than the in the ear ones, because it's usually just a thin wire along the side. We have some samples over there as well if you wanted to take a peek. And those ones are rechargeable. So you put them on a charger at night, you take them off the charger in the morning, and there's no more batteries to change. Okay. So I just also wanted to talk quickly about a remote microphone system, because I think it's really important too that there will still be situations that you may find difficult even with your hearing aids. So if you're wearing your hearing aids, you're wearing them all day, but you're still in a space where, like this, where there's a high ceiling, hard floors, hard walls, there's some nice acoustic panels. Thank you. But again, remote microphone systems might be helpful. So similar to the way this FM system picks up my voice and sends it to a speaker, there are some remote microphone systems where the speaker could wear a small microphone, and the sound actually gets sent directly to the hearing aids. So it's particularly helpful in noisy situations, in groups, or over large distances. So whatever the speaker is saying will get transmitted or sent either through Bluetooth or through FM technology to the hearing aid. And I find that really helps for listening clarity and reduces listening fatigue, particularly in a restaurant or something like that. So it's also just important to remember that hearing aids are not a one-size-fits-all solution. So each type of hearing loss requires a unique approach. So that's why a comprehensive assessment and a listening needs determination is really important. And then there's various technology levels as well, depending on what you need, what your lifestyle requirements are, and then also the type of listening support that you need and where you need it. So now I'm just going to talk a little bit about hearing loss and cognitive health, because I think that's a really big, important area right now. Before I move on, are there any questions? Yes.
Could you maybe talk to what medications might be involved in the hearing loss?
Yes, I can. So there are particular types of medications called ototoxic medications. Did you want me to answer that after? Is that?
No, that's
Oh,
fine.
okay.
Just, I think the Zoom people will figure the question out. It's just that.
Oh, right. Yeah. So the question was, which types of medications are related to hearing loss? So there's certain types of ototoxic medications, that's what they're called. There's a particular chemotherapy called cisplatin. So any cisplatin-based chemotherapy can be known to cause hearing loss. We would usually do a hearing test before treatment and after treatment. There are also some myosin drug families, gentamicin, bentamycin, streptomycin. Those are particularly ototoxic to both the hearing loss portion and then the balance, organs of balance and hearing are both affected by those particular medications. Oh yeah, not all myosins. Yeah. So Lori's just reminding me, not all myosin families are ototoxic, just specific ones are. So if you have any questions about that, then you can always speak to your doctor about the prescription. Does that answer your question? Welcome. All right, so we're just going to look at dementia and some risk factors for dementia. So there are two kinds of risk factors for dementia. One is modifiable and the other is non-modifiable. Some studies have identified several modifiable risk factors associated with a greater risk of developing dementia. And so it's also estimated that there's 12 risk factors that could explain approximately 40% of cases of dementia globally. One of those modifiable risk factors is hearing loss. So this next slide is just taken from the dementia risk factors and prevention portion of the Health Canada website. And you can see, if I get my pointer correct, there we go. So right on this graph, right here at the top of the second from the top, hearing loss is one of the identified modifiable risk factors for dementia. So a healthy lifestyle can help lower the chance of developing dementia and delay symptoms, as well as prevent other chronic conditions that in turn are related to a greater risk of developing dementia. So Health Canada recommends some lifestyle changes, and one of those lifestyle changes to reduce your risk of dementia is protecting yourself from hearing loss, both from using hearing aids to correct or balance any hearing loss that you already do have. And the second is by using ear protection when you can't avoid excess noise. So a lot of people think that excess noise is factory noise, for example, if you're just listening to constant steady state noise at work, but it's not. So things like loud music can be considered excess noise if you're listening to it for prolonged periods of time. Cutting the grass, weed whacker, those types of things they're noisy. And if you already have hearing loss, then we want to be able to protect the hearing that you do have by using some noise reduction strategies or earphones, earplugs when you're cutting the grass. The number 2 lifestyle change is socializing regularly with friends and other members of your community. So getting together like this, you get together once a month. So I think that's really important. You'll see in later slides that social interaction is really a main component. So why is untreated hearing loss a risk factor for dementia? So there's 3 main theories. One is cognitive load. So with untreated hearing loss, the brain gets overworked. It gets tired. It's straining to understand speech. It's straining to understand sound. It's straining to make sense of what's being said and filter out some of that background noise. The second is the actual brain structure itself. So the brain cells can shrink from lack of stimulation, including parts of the brain that receive and process sound. So if we're not constantly using those particular areas of the brain, they get less work, and then those brain cells themselves can actually change. The other one, which I find is the most important, is social isolation. When a person has trouble hearing conversations, they'll often isolate themselves. They say no to social events. They stop going out with friends. Even family gatherings become effortful. When that person withdraws socially, their brain receives less stimulation because they're not having as much communication throughout the day, even if it's something small like a walk with a friend or a telephone conversation. So I'm just gonna sum it up here. So in terms of making the connection between dementia and hearing loss, treating hearing loss in adults may slow cognitive decline, but the main kind of connection piece is how better hearing or how treating their hearing loss with hearing aids allowed them to stay involved in their everyday lives. So that's what the research found. It's not that putting on hearing aids is going to then stop you from having dementia. It's that social interaction piece and how it allowed people to maintain social, maintain being social, maintain being part of families, and really giving the brain that stimulation from those interactions. And then so by restoring the ability to communicate, the hearing aids improve the social interactions, which then improves mood because social isolation can lead to some depression. And it also provides the opportunity to participate in some brain stimulating activities like group situations, friends, and social interaction, which then can slow cognitive decline. Okay. And so I'll just jump gears for a quick second and talk about risk of falls. So falls is something that's also really prevalent in hospital emergency rooms. So they're actually, falls are the leading cause of hospitalization and injury, resulting in permanent disability for adults in Canada. People with hearing loss fall up to 2 times more than somebody who doesn't have a hearing loss. As hearing worsens, the risk of falls increases. So even a small change in your hearing can significantly increase your risk of falls.
I think too that the same question that came up earlier about medications. I think that they can perhaps have a major impact on the risk of people taking falls.
And so the question or the comment was that medications can also have a major impact on fall risk. Yes, 100%. I cannot speak to that because again, I'm not a medical doctor, I'm audiology, so I can only speak to the hearing in falls, but I have heard from other clients and patients as well that there are some medications that can have effect on the vestibular system and increase the fall risk. I think when we're coming back to the hearing loss portion, people are much less aware of their surroundings if they have a hearing loss. You're not able to localize where the sound is coming from. It's more difficult for you to figure out where you are in space relation to, difficult where you are in space in relation to what's around you, right? So if you're, for example, have hearing loss and you're walking across the street and you hear a bird and the bird is coming from this side, but you think it's coming from this side and there's a curb, you may look and fall. So that's just a small example, but again, it goes to show how hearing loss can relate to that risk of falls with regards to where sound is coming from and localization. And the other thing too is a lot of people are fatigued. So you're tired after listening, if you've been out to a restaurant or something like that, and you can, it's hard to focus on your walking, your balance, identifying tripping hazards, and listening at the same time. So we're just moving on to some hearing aid benefits. And these are some screen captures directly from the Speech and Language and Audiology, Speech, Language and Audiology Association of Canada. Just going through how some untreated hearing loss can result in withdrawal, like we talked about, embarrassment, damage to personal relationships if you're finding that you're really not wanting to communicate, irritability with being unable to communicate effectively, stress, loneliness, isolation. And then it goes to show that there are some research that shows that using hearing aids significantly improves quality of life. So people have rated 65% better relationships, overall, or life overall, 65% improvement in their overall life from getting fit appropriately with hearing aids. And again, just some hearing aid benefits overall. So participating more in social activities, having less difficulty communicating, having less anxiety, feeling better overall in your mental and physical health, more alert, more in tune with your environment. And then again, just this last one here, I find really important for cognitive health overall. So when it comes to depression, this study mentions that there's 36% more people, 36% more likely to have suffered from depression within the last 12 months, somebody who has a hearing loss versus somebody who doesn't. And that improvement in the depression overall happened within just 3 months of getting fit with hearing aids. So again, with that cognitive piece, we want to make sure that we're reducing the depression if possible, related to social isolation, not related to other things that I'm not discussing here. And then also improving that social communication. So again, just early intervention is key. And I think this is important because 1 in 10 people actually have a hearing loss. 90% of those with hearing loss can benefit from hearing aids, but only 1 in 5 people of those that can benefit actually get a hearing aid. So intervening early, coming in for your hearing assessments, seeing where you're at in terms of your hearing levels, your thresholds, and looking at hearing aids to improve your overall quality of life and communication and reduce that risk of dementia is really important. And at this point, I'm going to hand it back over to Lori.
Great job, Terry. It's a complex topic and she did a great job covering it all. Okay. Wondering where to go from here. You can book an appointment with us if you're interested in coming in to see us. We hope you do. We see familiar faces out there. We hope to see more familiar faces from here in our clinic. Ways to do it. On that, one of the first slides I presented with our staff, I think I forgot to mention our scheduler, Jamie, who's absolutely wonderful. And that's her extension up there. So if you wanted to call Hotel du Shaver, that extension, you'll be speaking with Jamie, who could get you an appointment. Or you can visit our website. You can actually request an appointment on our website, and then we will contact you and book it for you. Jamie will do that. The Audiology and Hearing Aid Clinic at Hotel du Shaver, just to summarize it all, hearing tests for all ages. I mentioned we do pediatrics as well. We currently have no wait list, and we do not require a physician's referral. We do sell hearing aids, and we do support them through the life of the hearing aid. Hearing aids can last anywhere from 3 to 5 years. I've seen 7-year-old hearing aids doing a great job out there too. We support you through that. We do hearing aid consultations, prescriptions, as Terry had mentioned, based on both your hearing loss, your audiogram, that graph that Terry showed you, and lifestyle listening needs. So what do you do during the day? You come here. You might go to the golf course. You may be, and we're going to come up with a listening strategy for you with hearing aids to help you in most of those situations. As Terry mentioned, some of those situations we can't overcome with hearing aids alone, and that's when we can suggest other devices as well. Some of the Bluetooth accessories or other assisted listening devices like an FM system, an EduMic, things like that. We provide 3-year hearing aid care package with regular hearing assessments and hearing aid checks for your hearing aids at no additional charge to maintain optimal benefit from hearing aids purchased at HDS. We do charge for hearing tests, but when you buy a hearing aid from us, we don't charge for 3 years for the warranty period of the hearing aid. And if you do come in just for a hearing test then, and then decide to buy a hearing aid from us later, we reimburse that fee. And then we don't charge you again for another 3 years when the warranty of the hearing aid expires. Our clinic provides services for the following third-party payers and agencies. So ADP, that gives you $500 per side for a hearing aid. WSIB, if you have that coverage, we do support that. Veterans Affairs Canada, the Infant Hearing Program. I don't think anybody here is a member of the Infant Hearing Program, but you may have grandchildren that you have that are in that program, and we do provide services for that. Ministry of Community and Social Services, non-insured health benefits for First Nation and Inuit Health Benefits of Canada, and social assistance and employment opportunities, or Ontario Works. And at this point, I want to thank you all for having us here today. It's been great. And if you have any questions, Terry and I come up, and we'll address any questions that you may have.
How do you tell you're getting the most of the hearing aids you have?
Good question. How do you tell you're getting the most?
To cancel the screen share.
Oh, sure.
No, sorry. You just have to remember how to do it. There you go.
Okay, so the question was, how do you tell if you're getting the most out of your hearing aids, correct? I guess it would be, and how you do in situations like this, how well you're hearing at home, and how you feel at the end of the day, if you're feeling fatigued at the end of the day, or if you notice with hearing aid use that your fatigue lessens.
That's okay.
Yeah.
Also, if you come in for your appointments, if you come in, let's say you get your hearing aids and you come in a year later for your annual hearing assessment and we retest your hearing. If your hearing's changed, we can always reprogram the hearing aids to current changes in hearing. One of the things that we do for every hearing aid fitting is we verify the programming to make sure that you're meeting the targets for optimal speech and language. So most of the time, those targets are for high-pitched sounds, low-pitched sounds, depending on the configuration of your hearing. So if we're matching the targets that are generated through lots of research at Western University for your hearing loss, then you should be doing quite well. Again, those targets are typically for quiet situations, so noisy group situations may be a little bit more challenging, and we do expect that. Noisy situations are more challenging for people who don't have hearing loss as well, because there's so many variables and so many different sources of input. But if the hearing aids are verified appropriately, they're at those targets and you're wearing them without turning the volume down, then your fitting is optimal for where your hearing loss is.
Well, yeah, that's great. That's a good answer, Terry. And one thing I've always said to my patients is our job is for you to come back to us until your hearing aids are acceptable both physically and acoustically. So if you're not doing well with your hearing aids, come back and see us, and we will make sure they're hitting targets, make sure that your hearing hasn't changed. So.
And there was another question.
My wife recently had a test and she now has hearing aids. They're the little rechargeable ones that you could hardly notice. Unfortunately, she didn't go through you guys. She went through another well-known private firm in town, and an international firm probably. And $7,000 later, she has these very nice hearing aids. How much is covered by the government? I think it was $1,000. Fortunately, the other $6,000 was covered through her pension, health benefits through her pension, which covered the rest. Thank God, because otherwise we'd have been out of pocket a large amount of money. So what is the cost to you, but what is the cost of a hearing aid setup?
To go there, you want me to? Sure. Okay, so the question is, what is the range or the fees for hearing aids?
Yes.
Right. So there's a few things that we take into account when you're looking at hearing aids. So one is the device itself. So the device itself, and then I'll give you the actual range. The device itself is the manufacturer cost, and that's dependent on which technology you level you choose. The higher end technology will have more noise support, more features in the hearing aid to clean the signal before it gets to your ear, gets to your brain. The lower end hearing aids are better for one-on-one. They don't fare as well in group situations. Then you have the dispensing fee, which covers your programming, hearing aid checks, that care package that we talked about for a 3-year period of time, which is also the length of the warranty of the hearing aids. And so that total amount for 2 hearing aids can range. So right now, if we're looking at more of the entry level hearing aids, probably somewhere between 32 and 3,500 if you're looking to, for 2. This is for 2, right? So about that, but you can go all the way up to, I think at our clinic, most recently, the most expensive one would be 5,500. So about that range. I think that's something 10 plus. Yeah. So again, the pricing can vary, and it very depends on your needs, but the variation depends on your needs. But yes, they range anywhere from about, for a set, about 3,000 to about 5,500.
Now, presumably you are a non-profit organization. Is that right? So it would be cheaper with you than it would be with a profit-making organization.
Well, excuse me, we are a profit generating department within the facility, within the hospital, and all of our profits are reinvested back into the hospital. Our prices, we tend to get better prices from some of our manufacturers, and that's what keeps our pricing low. And
I guess we do make profit, but it's for the hospital.
yeah,
Yeah.
good question. Yeah, like any profits, any proceeds from the sale of a hearing aid goes back into the hospital. None of our staff makes a commission on any hearing aid. When they do a listening needs assessment with you, they're looking at it from an acoustic point of view. What do you need to hear better? And then what's going to fit into your budget? You know, we're not selling everybody top of the line hearing aids. We're not selling everybody entry level hearing aids. We're trying to get something that is going to meet both your listening needs and your financial budget. Answer your question? Okay, we have another question here.
Comes after the 3 years.
Okay, the question is what happens after the 3-year warranty expires? After that, hearing aids are still very viable after 3 years in many cases. We just, when you come in for a hearing test at our clinic, we would charge you for the hearing test. Currently, that charge is $65. And then we would charge you for the hearing aid check. So what that involves is going on the computer, putting your test into the computer, calculating where your hearing aid should be set, and then setting them, reprogramming them if need be. Not everybody needs that part of it. A lot of times the hearing aids are functioning fine, and we just do a quick checkup and clean, and there you go. But after the 3-year period, you are paying for those services.
Okay. Another question?
Another question?
Yeah, I have 2 questions.
Okay.
Okay.
How often should a person that has hearing aids, how often should they go for a hearing test?
Sure.
So the question was, how often should somebody who have hearing aids go for a hearing test? So at our clinic, we recommend annually. So annually based on the date of when you had your last hearing test or when you purchased your hearing aids. If at any time between those 2 appointments, you're noticing a change in hearing, you feel like you want your hearing aids checked or your hearing checked, if you are noticing differences, if you have a sudden change in hearing or you're having any tinnitus, ringing, buzzing, feeling of pain, pressure, fullness in your ears, anything that would warrant another hearing test, you can come and have that done. And that's included. Yeah, and that's included. It's not just, one hearing test every year. If we need to bring you back sooner or you feel you need to come back sooner for your hearing test, that's included in that 3-year package. But the short answer is minimally every year. Yes.
My other question
Yeah.
is, person hasn't bought their hearing aids from you
Yes.
and they come to you for a hearing test,
Mhm.
you have the ability to check the current hearing aids that they have. Do you have the ability to check or to adjust those hearing aids even though they haven't been purchased from you?
So the question is, if somebody purchases their hearing aids at another clinic and then they want to come to us, do we have the ability to check and adjust the hearing aids? Most of the time, yes. It will depend on the type of hearing aid and the manufacturer. Sometimes it does depend on where it was purchased, or if the hearing aid is, for example, locked to a particular type of vendor, then we are unable to, but again, we would let you know that beforehand.
Just want to say most
Yeah.
cases.
In most cases, we do. In most cases, we do. We have clients who come to us if they're inpatients and they're coming, you want their hearing aids checked, but they've never purchased from us and they want to now come to us. We can do that. We also have people who've purchased from outside organizations, other clinics who come for second opinions or readjustment of their hearing aids.
What about cleaning supply?
And the question is, what about cleaning and cleaning supplies? Yes, we sell all the cleaning supplies there and everything you need to support your hearing aid. When you purchase a hearing aid, you're getting some cleaning supplies with the hearing aid. Many of those are covered during that care, in that care package as well. And outside of the care package that you just pay for.
No, cleanings.
And we do cleanings, like we instruct you on how to clean your hearing aid to keep it working well, but we also do, if some people have dexterity issues and just aren't able to clean their hearing aids, and we do provide that service as well.
There's one more question that's what we have time for.
Go ahead.
This is a personal experience. Play golf with two guys. One guy could hear the golf ball drop on the fairway. The other guy couldn't hear you if you're standing in the cart. Does that mean that they could both be equal and be adjusted to become equal? Or is this something that is inherent? They will never be equal in hearing?
Both wearing hearing aids?
Yeah, both wearing hearing aids.
Okay, so the question is, two people that you golf with wear hearing aids, and one hears really well, can hear the golf ball landing on the green, going in the hole, and the other guy can't carry on a conversation very successfully.
Because he can't hear us.
He can't hear you clearly. And I would say, and I'm gonna let Terri take this one too, because she, I'm sure, has some really good information to add to that, but it depends on the hearing loss we're starting off with. So that audiogram, it depends on what is in that, how clearly they're hearing speech on top of it. And then hearing aids, how they are fitted, how they're adjusted. So there's a lot of factors. Now, there is something that Terri mentioned earlier, and that was word recognition. That sometimes, like, a hearing aid can make things louder. It can focus on the frequencies that you need to hear better. Sometimes, despite that, we can't overcome that inherent word recognition. And some people just have a low word recognition score, meaning that speech does not sound as clear to one person as it does to the other. And we sometimes cannot overcome that. And that's why we monitor that.
So it's probably unlikely that the two could ever become equal.
So, without seeing their audio, I would say it may not happen, right? But again, there's other things that we can do. So let's say we've programmed the hearing aid appropriately and he's still having difficulty. His word recognition is not as strong as the other person's, and they're just not able, he's not able to communicate. So one of the things, instead of leaving at the table, you would look at an assistive listening device. for example. So again, wearing a small microphone so that the sound is going directly from the speaker's voice into his hearing aids. That way you're reducing the amount of background sounds that he's having to filter through. Sometimes that's a small microphone that goes in the center of the table and just picks up the voices at the table only and filters out the noise. Other times it can be a Bluetooth stream. So if you guys are talking on the course, you're wearing a microphone and he wants to hear what you're saying, it reduces the distance between your voice and him. Again, I think the audiogram, so the configuration and type of hearing, the word recognition, so that clarity piece and how much discrimination ability is left in the auditory system to distinguish between speech sounds is really important. And then also looking at auditory processing. So again, what the brain does with the input coming in are three factors that would really determine the difference between two people with hearing aids who function completely different.
I think our time is up. I just wanted to mention that we brought some brochures here in our business cards, and there are some models of hearing aids. So if you have time, and you want to come over here and have a look at them or take a brochure or a business card, feel free. Thank you so much for having us.
Thank you. The presentation was very enlightening, very thorough. Your organization specializes in hearing, and I think the message that came through loud and clear was that you're a very professional organization. And if somebody has a question or an issue with hearing, you're probably second to none in terms of the depth of your knowledge and services that you can provide. The second part of this is a thank you. And the thank you is, while you are a hearing organization, has a ton of specialty in the top of your game, we are a social club. And our thank you we wish to share with you is a social gift that you two can enjoy together. It's a $30 gift certificate from the LCBO. It may or may not help your hearing, but it's going to help your mind.
Social. Thanks so much.